Welcome to the deep dive. You've shared some really interesting material with us, and looks like you want to really understand it fully.
That's right.
So today we're diving into a health issue that, well, it can affect both dogs and cats, glomerulonephritis.
Exactly. We've got excerpts here from canine and feline glomerulonephritis, and the plan is to pull out the key info about this condition, make it clear, highlight what's important.
Okay, glomerulonephritis. It's quite a term.
It is.
But basically, we're talking about problems with the glomeruli. These are the kidneys, tiny filters for it.
It's the core idea, yes. They're the filtering units.
And it's important to know right off the bat that while this condition involves inflammation of these filters, well, not all glomerular issues are inflammatory.
That's a really key distinction, yeah. You can get damage to the glomeruli in other ways, but glomerulonephritis specifically, that points to an inflammatory process messing things up.
Okay, so what actually causes this inflammation? What kicks it off?
Well, the most common trigger, usually, is the buildup of immune complexes. Think of them as little clumps of antibodies stuck to antigens. These complexes can circulate in the blood and just get trapped in those kidney filters, or sometimes they actually form right there within the glomerular walls.
Okay, so they get lodged in the filters. What happens then? That sounds like where the trouble really starts.
You got it. That's when the damage cascade begins. The presence of these complexes triggers the complement system that's part of the immune rapid response causing inflammation. Then you get white blood cells rushing in, platelets starting to clump, and fibrin, that's a clotting protein, getting deposited. It all damages the glomerulu's delicate structure.
And a major consequence is losing protein, right? Into the urine.
A huge consequence, yes. Vital proteins leak out of the blood.
And that protein loss, I mean, it can't just be a kidney problem. It must affect the whole body.
Absolutely. Over time, this constant attack leads to thickening and scarring. The cells multiply, the supporting membrane thickens. Eventually, the filters get scarred and hardened. That's glomerular hyalinization and sclerosis.
So they stop working properly.
Right. You lose functioning nephrons, the kidney's workhorses, and that progresses ultimately to chronic kidney disease, specifically azotemic CKD, where waste builds up.
Wow. So it starts small in these filters, but the effects ripple outwards. What other body systems feel the impact?
Well, the kidneys themselves obviously show the first signs, mostly protein in the urine, often without many inflammatory cells at first.
Okay.
As it gets worse, you see the azotemia waste build up, leading to that uremic CKD stage. But the cardiovascular system takes a hit too.
How so?
Losing protein, especially albumin, messes with fluid balance. That can cause edema swelling, often in the legs, or ascites, which is fluid in the belly. And high blood pressure hypertension is very, very common.
And I think I saw something about cholesterol.
Yeah.
And blood clots.
Yes, exactly. The body tries to compensate for protein loss, which can drive up cholesterol levels, hypercholesterolemia. And the blood can become more prone to clotting, too. That's hypercoagulability.
Which increases the risk of
thromboembolic disease. Basically, dangerous blood clots forming and blocking vessels. It's a serious potential complication.
This really sounds like a major health issue. Is there a genetic link? Are some breeds more likely to get it?
There definitely is, in some cases. We know about familial forms, inherited forms of glomerulonephritis in quite a few dog breeds.
Oh, really? Which ones?
Well, the list includes Bernese Mountain Dogs, Brittany Spaniels, Bull Terriers, Bull Mastiffs, French Mastiffs, Dalmatians, Samoyeds, Dobermans, Cocker Spaniels, Newfoundlands, Rottweilers, Pembroke Welsh Corgis, Beagles, and soft-coated Wheaten Terriers.
Wow, that's quite a list. So if you have one of those dogs, is this something to be particularly watchful for?
It's certainly something to be aware of. It really highlights why regular vet checkups are so important. And beyond those specific inherited types, Labradors and Golden Retrievers seem to have a higher risk for glomerulonephritis associated with Lyme disease, from the Borrelia burgdorferi bacteria.
The Lyme connection.
Yeah, and in those cases, kidney function can sometimes decline quite quickly.
So just how common is this overall in dogs and cats? Is it something, most pets might encounter?
It's interesting. Subclinical glomerular disease changes without obvious symptoms seems to be pretty common in dogs.
Subclinical, meaning they have it but don't seem sick.
Exactly. Some studies suggest up to 90% of randomly checked dogs show some lesions in their glomeruli at necropsy. So many dogs might have some level of change, but it's the progression to actual illness that's the worry.
90%? That's surprising. What about cats?
It appears to be less common in cats, generally speaking.
Okay, so lots of dogs might have underlying changes, but who's more likely to develop the full-blown symptomatic disease?
Well, we definitely diagnose it more in dogs than cats. And as we said, certain breeds have that genetic predisposition, or like Labs and Goldens, links to specific infections.
Right.
Age is a factor too. The average age for diagnosis in dogs is usually around 6.5 to 8.5-year old.
Okay.
But those hereditary forms, you might see protein in the urine way earlier, even before 6 months.
Wow. And cats?
In cats, the average age tends to be younger, maybe around 4 years.
And any difference between males and females?
Not really in dogs, no clear gender preference, but in cats, it does seem more common in males. Maybe around 75% of cases are male cats.
Huh. Interesting. So if a pet does develop this, what signs might an owner notice, especially early on?
Early on, it's often, well, silent. That initial protein in the urine proteinuria usually doesn't cause outward signs.
So it's found by accident.
Frequently, yes. During routine health checks, a urine test picks it up. Or sometimes owners bring their pet in for something else entirely, like an infection, that turns out to be the trigger for the immune complexes.
Okay. And as it progresses, what might you see then?
Well, if the protein loss gets bad enough, so low albumin levels, say below 1 or 1.5 grams per deciliter, that's when you might see the fluid retention.
The swelling.
Yeah, swelling in the legs, or that fluid in the abdomen, the ascites. And once enough kidney function is lost, when you get into azotemic renal failure, that waste buildup, then you'll likely see more obvious signs.
Like what?
Increased drinking and urination, poor appetite, maybe nausea, vomiting, lethargy, weight loss, those nonspecific signs too.
Okay.
And less commonly, but more seriously, you might see sudden breathing difficulty, maybe from a blood clot in the lungs, or even sudden blindness from eye issues related to severe high blood pressure.
Gosh, it sounds like a lot of those signs could point to other things too. What actually causes this? Is it always clear?
That's a really crucial point. True autoimmune glomerulonephritis, where the immune system directly attacks the kidney, that's actually pretty rare.
Oh, okay.
More often, it's linked back to those immune complexes we talked about, and those can be triggered by a whole range of infectious and inflammatory diseases.
Can you give some examples for dogs and cats?
Sure. In dogs, think infections like anaplasmosis, Lyme disease, heartworm, even chronic bacterial infections like pyometra or deep skin infections,
Right.
cancer too, or inflammatory conditions like lupus, even hormonal issues like Cushing's disease or diabetes, or long-term steroid use, and those inherited forms, of course.
And for cats?
In cats, things like FeLV, feline leukemia virus, FIV, those viruses, also certain cancers.
But you don't always find a cause.
No, and this is really key. In many, many cases, both in dogs and cats, we just can't pinpoint the underlying trigger. We call that idiopathic unknown cause.
Okay, so the signs can be vague, lots of potential causes, sometimes no known cause. Yeah. How do you actually diagnose it then?
Diagnosis starts with ruling out other reasons for protein in the urine. You know, a bladder infection can cause proteinuria too. But usually with an infection, you see an active urine sediment bacteria, white blood cells, under the microscope. That's less common with glomerulonephritis.
What else needs ruling out?
High levels of blood proteins called globulins can sometimes interfere with tests. And another condition, renal amyloidosis, can also cause significant protein loss with an inactive sediment looking similar.
So it can be tricky?
It can. Really, the only definitive way to diagnose glomerulonephritis and figure out the specific type is a kidney biopsy.
A biopsy. That sounds pretty involved. Are there simpler tests first that point you in that direction?
Oh, absolutely. Blood and urine tests are fundamental. A CBC, complete blood count, is often normal.
Okay.
But on the chemistry panel, especially with significant protein loss, you might see low albumin and high cholesterol.
And the urine?
Urinalysis is key. We're looking for persistent protein, usually without that active sediment, though you might see things called casts. Very early damage might only show up as microalbuminuria, tiny amounts of protein. And later, as kidney function declines, you see the typical kidney failure markers go up, like creatinine and BUN.
And you mentioned the UPC ratio earlier, the urine protein creatinine ratio.
Yes, the UPC. Super valuable. It confirms abnormal protein loss and, crucially, quantifies it.
So you can measure how bad it is.
Exactly. And then we use it to track response to treatment, see if the disease is progressing or maybe even improving, though that's less common. One tricky thing in very advanced kidney failure, the UPC might actually decrease just because so little is being filtered overall, so you have to interpret it carefully.
Got it. Are there other, maybe more specialized tests?
Sometimes. Protein electrophoresis on urine or blood can occasionally help spot underlying issues like certain lymphoid cancers.
Hmm.
And imaging, like ultrasound, is useful for looking for those potential underlying causes: inflammation, infections, tumors that might be driving the process. Kidneys might look mildly enlarged sometimes.
Okay, you said the biopsy is definitive. Can you elaborate a bit on that? When is it done?
So the biopsy lets us look right at the kidney tissue. See the pattern of damage. Is it membranous, proliferative, scarring? This helps distinguish the subtypes.
And that affects treatment?
It can influence treatment choices and gives a much better idea of the prognosis, the likely outcome, but it is invasive.
Right.
So it's usually considered after other tests, and you need to make sure the pet's blood clotting is normal first. There are reasons not to do it too, like if there's only one kidney, bleeding disorders, certain kidney cysts or infections.
Makes sense.
And the risk is higher in tiny animals or those already in severe kidney failure. If we do a biopsy, we look for things like thickened membranes, extra cells, scarring. And it's crucial the sample is handled properly for special tests, immunofluorescence, electron microscopy, that give really specific details.
Okay, so let's say it's diagnosed. What's the management plan? Are there good treatments?
Management usually involves several things. Diet is important, often switching to a prescription renal diet. These are typically lower in sodium, controlled, high-quality protein. But ideally, the best treatment is finding and fixing the underlying cause. If it's an infection, treat it. If it's inflammation, manage it.
But you said the cause is often unknown.
Exactly. That's the challenge. If it's idiopathic or the cause can't be eliminated, like some cancers, then we manage the consequences.
So medications. What drugs are used?
ACE inhibitors, like enalapril, are a cornerstone. They help reduce protein loss by tweaking pressure inside the filters, and they help lower blood pressure.
Okay.
There's evidence, particularly in dogs with idiopathic GN, that they might help slow down the disease progression. We usually try to start them fairly early unless kidney failure is already very severe.
What about drugs to suppress the immune system, since it's inflammatory?
That's the interesting part. Even though it is inflammatory, studies in pets haven't generally shown a clear benefit from broad immunosuppressants like steroids or cyclosporin for most cases.
Really? They could even make it worse.
In some situations, yes. They've sometimes been shown to worsen protein loss or the outcome, so they aren't usually the first go-to.
Okay. What about that clotting risk?
Right. Low-dose aspirin might be considered, especially if albumin is very low, or we know there's low antithrombin, which is a natural anti-clotting protein. It helps reduce that risk a bit.
So immunosuppression isn't standard, but are there times it is considered?
Yes, potentially. Certain subtypes identified on biopsy, like maybe membranous glomerulopathy before there's a lot of kidney damage, might respond. That's where the biopsy info is really helpful.
Ah, I see.
Or if a biopsy isn't done, maybe in severe cases like rapidly worsening kidney values, very high creatinine, severe low albumin that aren't responding to standard care like ACE inhibitors and diet. But it's a careful decision.
And you have to be careful with drugs in general with kidney patients, right?
Absolutely. Especially drugs that are cleared by the kidneys or bind heavily to proteins like albumin dosages might need adjusting. Even ACE inhibitor doses might need tweaking if waste products are really high.
Okay. So once treatment starts, what's the follow-up like?
Yeah.
And what's the long-term picture?
Regular monitoring is absolutely key. Checking that UPC ratio periodically to see how the protein loss is doing. Blood tests for kidney function, albumin, electrolytes, blood pressure checks, tracking weight.
How often?
For a stable patient, maybe rechecks at 1 month, 3 months, 6, 9, 12 months after starting treatment, something like that. But it's important for owners to understand.
Yes.
Unfortunately, the disease often progresses anyway despite treatment. Once chronic kidney failure develops, the prognosis is usually considered guarded to poor.
That's tough. Is there anything people can do to prevent it?
Well, for those inherited forms we talked about, the main thing is responsible breeding. Avoiding breeding affected animals or their close relatives.
Okay. And just to recap, what are the major complications owners should be aware of?
We've touched on them, but the big ones are nephrotic syndrome, that combination of severe protein loss, low albumin, high cholesterol, and edema or ascites.
Right.
Also high blood pressure, the progression to chronic kidney failure itself, and those thromboembolic events, the blood clots.
This has been incredibly informative, really unpacking glomerulonephritis. To wrap up, what are the absolute key takeaways for our listener?
Okay, so glomerulonephritis. It's inflammation, it's damage to the kidney filters, usually from immune complexes, kind of a misdirected immune response.
Uh-huh.
It hits the kidneys and cardiovascular system hard. Genetics matter for some breeds. It can link to other diseases, but often the cause is a mystery, idiopathic.
And early signs are subtle.
Very subtle, often found on routine urine tests. Diagnosis means ruling out other things. Biopsy is definitive. Treatment involves diet, ACE inhibitors usually. But tackling the underlying cause is best, if you can find it.
But the outlook.
The outlook is often guarded, sadly. It tends to progress, especially once kidney failure sets in.
It's definitely complex and sounds like it varies a lot between pets. Think about how common those subclinical changes are, especially in dogs. It makes you wonder, doesn't it? Perhaps it raises questions for you listening about whether more screening could be helpful, or maybe what environmental triggers might be involved in setting off these immune responses in our pets. It's something to consider. But remember, this deep dive is really just a starting point. If you have any concerns at all about your dog or cat, the most crucial step is always talking with your veterinarian. They can help you understand your pet's specific situation and health.